Good evening. My name is Lauren Trunko, and I'm the Director of Women and Family Services here at YWCA Northeastern New York. Thanks for joining us tonight. I want to introduce our panel tonight. We have Taking Your Mental Health Temperature During COVID, a panel discussion that was organized by the Advocacy Committee of the Board on the YWCA Northeastern New York. And so to start out, I'd like to introduce our panelists, and then I'll tell you a little bit about why we chose this topic, and then we'll get right into the discussion. So first, I'm just going to go kind of based on who I see. So if you could unmute yourselves and introduce yourselves to the audience. Anita, would you go first, please?
Hello, everyone. I'm Anita Andersen. I'm currently serving as an elementary counselor. I'm also a positive educator and a life coach. And it's great to be here this evening.
Thank you. Ebony?
Hello, everyone. My name is Ebony Belmar, a social worker in Schenectady City Schools. I'm at Mount Pleasant. I've been there for a really long time. I'm also a founding mother for the working group on Girls and Boys Day Out. Great being here.
Thank you. Sandra?
Hi there, I'm Sandra Goldmeer. I'm the area director for the American Foundation for Suicide Prevention, as well as a board member of the YWCA.
Great. And Janice?
Hello, everyone. I am Janice Rouse. I am a recently retired 35 plus year social worker for Schenectady County. I'm also a member of the Schenectady NAACP in regards to advocating and just working with the community. So I'm looking forward to this discussion.
Thank you.
Thank you.
Mary, please.
Hi, I'm Mary, who's been practicing unmute in my mind while all of you were introducing. I am also a school social worker in Schenectady, and I also have a small private practice in Schenectady as well. And I've been working in Schenectady, which I'm very happy and proud to say, my whole clinical career.
Amazing. Such a wealth of knowledge just in this small little screen on people's computers. I'm so happy to have you all here tonight. As part of the advocacy committee for the YWCA, we discussed having panel discussions really each month to focus on different topics. And so January is typically a time where people are focused on New Year's resolutions, thinking about a clean slate, goals for the year. But I think as we kind of got into January, we realized that a lot of the same stressors of 2020 followed us into this year. They didn't really go anywhere, even though the calendar flipped and we started a new year. And so we wanted to really just take an opportunity to check in, take our temperatures, our mental health temperatures with everything going on and the layers and layers and layers of things that are creating so much stress for our community members. And so that's what this discussion is about. We want to just make sure that people know that they're not alone, that we're all feeling some level. Maybe some people have more layers than others, but we're in this together. And so we're going to get right into the questions and then wrap up so people know where they can get some support and some resources right here in Schenectady. And so I'm going to just go right into it in the first question. So without knowing the full impact that this pandemic will have on our mental health until it's over, because we're kind of in the middle of it right now, what do you believe is most significantly affecting us as we're navigating through this really unique time? Anybody want to take it off the top?
Well, I'll add if I just think that at this point in time, a lot of people who are dealing with isolation, the fears and anxiety of what is to come and, how things are going to turn out. I think people is just going to have a sense of deep depression, unfortunately. But on the hope side, and there is hope, and I like to tell people all the time that, there is really light at the end of the tunnel, and that, we are in a state of, not knowing and anticipating what's going to happen next. but we also know that hope and faith will take us a long way. And I believe that, if people hold on to that, that we'll get through this. But there is a lot of anxiety, as we see in our communities. Drug and alcohol use is increasing. Domestic violence is increasing. Our children are in a situation where they are kind of powerless in a way, and they're speaking that. So I just think that we're facing a lot of things, but there's definitely going to be hope at the end of the tunnel. I just wanted to throw that out there. Thank you.
Thank you.
And I'd like to just kind of piggyback too on what Janice said about when you said the kids are speaking it. And I think that when you said that, it so resonated with me, because when I think about the impact, and we know like anxiety, grief, loss, pain, worry, the ability to be able to speak it, and even more so having testimony and witness, people that are willing to bear witness to what others are going through. I think the impacts of crisis, and we're in a disaster, a natural disaster, prolonged. So clearly we're in a trauma period. But the difference between trauma and traumatized oftentimes is, how has your community responded to the pain that you're going through? And I think if there is a hope and light and all of the positive sides of pain are going to come from this, a lot of it's going to be, how is your community, whether that be your family, whether that be your neighborhood, whether that be your school community, how are they responding to what you're going through? And I think that is probably, in my perspective, one of the most vital aspects, and one of the great things about what's happening here and through organizations like the Y and other organizations that are pulling community together to pay attention to that voice.
I agree. And I think that if there is a silver lining to the pandemic, and they're often really hard to find, it is that we are talking more about our mental health, and that there's more open conversation about it. And I think that the only way to address mental health is to normalize its discussion, and to make it so that we discuss it just like we discuss our physical health. And one of the things I've been saying the whole time is, I think we did ourselves a huge disservice by calling it social distancing, because what we've been is physically distant from each other. Our social connections have never been more important than now, is connecting to community, connecting to each other. As Mary said, being willing to speak our truth about how we feel and how others feel, and being able to acknowledge that. Because once we do that, then it's out there, and then we can address how we do self-care for ourselves, and that I'll address later. But how we take care of ourselves during this difficult and challenging time.
I just have to throw the word war into all that's going on. America has been blessed in that in the recent past, there hasn't been any war on its grounds, but other countries have had to deal with real war. And in this case, while we can verbalize the name of the enemy, we know it's COVID, it's not as easy. The attacks come from everywhere, from so many different directions. And the trauma that it is leaving, and that it's causing, it's so unknown. It's just so new. The newness of what COVID is doing is probably the most difficult thing to deal with, because it's there, you have to fight, and who the enemy is, but we have to utilize weapons we've never used before. And so, yes, we see resourcefulness. Like you said, the community in so many ways is coming together. But again, it's war. And sometimes we're literally just fighting in the dark. And so our students, our young people are looking to us, and sometimes they have more answers than we have. So it's so important that we are also vulnerable and be willing to listen to folks who we may not have listened to before.
I am just struck by all the wisdom that I just heard in this group. I don't even know where to begin because I'd love to summarize and piggyback on things every single person has said so far, going back to what Janice was saying about, isolation and connection. I think that the isolation for so many different populations, whether you're a young person or you're an elderly person, having those opportunities to connect with others is huge. Hearing what Sandra had to say about this is starting a conversation that's a much needed conversation. And, I've been saying to colleagues, we've been talking about, I've been working in the elementary field for a long time, but I started out with adults and then high school and middle school and then elementary. And I feel like the way I explain it to people is we need to be talking about mental hygiene the way we spent years on dental hygiene. Like now everybody knows how to do all of that, but there are a lot of things that we could do for young people, for really young people, to help them during this time. And to connect with what Ebony said, my mom lived in an occupied country during the war, and we weren't very far into this. She's 87, and she turned to me and said, Anita, this is like wartime. And, she lived through it. And with wartime, when you're in an occupied country, comes a lot of uncertainty, and you don't know where it's all going to go. But connection with others and people kind of figuring out how are we going to show up and be part of the mitigation of what's happening. And I think having these kind of conversations really begins that process, is to be able to start to talk about it and say, okay, and in our own way, what can we do?
Yeah, some of the words that I heard that I do think are unique to what we're going through right now, that a few of you mentioned, are the isolation. Something that none of this, I'm only 37, but I'm sure this hasn't happened before in many, many years, where there's that feeling of not, the safety of leaving your house and being around the people that you love, and the risk that you're putting them in if you do have to go to work every day. It's just a constant stressor that's going on for everybody. And also powerlessness. A few people mentioned that, where there isn't, an answer. Ebony talked about the light at the end of the tunnel. We know it's there. We know we have to be getting there, right? At some point. But you're, like you said, you feel like you're kind of swinging in the dark sometimes and just trying to make it through. So I think those are very unique to what we're going through right now. At the YW, our mission is eliminating racism and empowering women. And so we look at it certainly through the lens, keeping our mission in mind. But I'm curious to see what your thoughts are about whether or not you believe women and people of color have been impacted more mentally or any other ways by this pandemic.
I think we don't have any specific data, but I think that, if you look at even just the unemployment numbers, is that it's been far more women who have lost their job and are out of work than men. In fact, I think last month, all of the job losses were female, and men actually gained. And so, and some of that may come from the need to be home with family members and take care of them. And so I think that the impact is different. Whether there's specific things, the impact is different and the stressors are different. And so I think that as we look at how to cope with the situation around us, and the word I wrote down as everybody was talking was what we're talking about, it's developing resilience. And how do we really create for ourselves and fortify ourselves to be resilient to what's going on. And we talk about that with our students and our youth as well. That's what we're trying. Those are the skills that we're trying to give them in these troubling times. And I think women and people of color being asked to take on a heavy burden. And it's about how do we provide and make sure that they are also taking care of themselves mentally, so that they have the strength to take on those extra things that are required of them.
I think oh, go ahead, Janice.
Okay, thank you. I would like to add that, I think that the CDC has.
Oh, your sound is a little off, Janice.
Okay, is that better?
Yeah.
Hello? Is
Yep,
that
you're
better?
good. Yep.
Okay. I think the CDC has put out some data in regards to how certain populations are affected in regards to the pandemic. And according to the CDC, people of color and women have been, have been hit more by this pandemic as far as the numbers of individuals that have been tested positive, the ones who have, passed away, etc. I think I read a study that said that I think it was like a 5.3 difference in people of color who were non-Hispanic speaking, who were affected by the pandemic. However, I think from a social work point of view and from a humanistic point of view, I like to believe that, if something hurts you, regardless of whether it hurted 20,000 people or 10 people, it's important. And so I think we're all affected. Yes, the numbers are higher for African Americans apparently, and there's some studies out on why that is. But I think that as a community, we're all just so affected by this, as an African American female, I have to say that I'm blessed. I've been tested 2 or 3 times and have come up negative. But I have people that I know personally that have passed away from the COVID-19. 2 in my family, a brother-in-law, and a cousin. So, I don't know who else can, what other groups may be able to say, well, I have somebody personally that I know that have passed away from the pandemic. It brings me to mind when we talk about our children and what they have to deal with today in regards to their friends and people that are in their peer group that are being killed by whatever means. When we were younger, I know that, I'm pushing 60. I don't mind telling my age. When I was in high school, I really didn't remember any of my peers dying from a gunshot wound or getting, a drug overdose. But when you ask the average 17, 18-year-old youth today, they know people. They are, directly, dealing with that. So is there a disparity in regards to the color and who, the barriers of who has more people that have passed away or that have been affected by COVID? According to the numbers, yes. But are we all seriously affected by this pandemic? We all are. I mean, everybody in their own way is affected by this pandemic, and it's gonna affect us for years to come. Some of us don't even realize how we're affected, how this is going to manifest itself 5 to 10 years from now. So I think that, yes, it has, according to the data, said that, more people of color are affected, but we're all affected by it. And that's just what I would like to add.
I'm really glad that Janice can talk about data. I not a numbers person, but I think we know that people of color and women started out already affected in more ways than the average individual in terms of the types of jobs that we hold, our income, our health, our ability to access health. So definitely this is impacting us more. I have parents that they're sick. They're not COVID sick, but they have to continue to go to work because they are the income. They are the mainstay of the family. They need to be taken care of. but they have children or parents or just family friends or other family members that they have to take care of. And the resource is just not there. It wasn't there in huge numbers prior to the pandemic. And we know resources are drying up in so many different ways. In addition to what we've just gone through, Black Lives Matter, like, hallelujah, the world is beginning to realize that racism is very much alive. But to see there, I have sons. And so just the fear, it's not just the fear of going out and working and possibly getting, COVID, but the fear is already there that my Black child is going out and all that. So I think the impact is definitely greater. A lot of my students are in female-headed households, and I see the struggle. Even if the community or the school, for example, makes food available, there's no transportation to get to it. So even when there's support, being able to access it is really very difficult. So I do think we are significantly affected. And Janice is right, we all are. And I especially want to acknowledge the piece where we don't even know how. Like, it's going to be months and years when, it really you begin to start to make sense of it.
Right. And if I can just add, not to take up too much time, because what Ebony said is correct, but, and there is a but for me, the but is that it's the racism, it's the systematic racism that has been perpetuated for many, many years. So if we take that out, which unfortunately is very much existing in our society, some of the impact that people of color is feeling wouldn't be there. But if it was just the pandemic that we're talking about, we all are affected. I mean, we all have to social distance. We all have to wear masks. We all are dealing in a community where the fear of trying not to get it, and not knowing how we will fare if we do get it. Some people have pre-existing conditions, some people don't. But the underlying issue, and I thank Ebony for bringing this out, because it's really the piece here, is the systematic racism that has been perpetuated in our country for years and centuries. And that is why African Americans especially is really being affected in a most grave way in regards to this pandemic and many other systems in our society right now. But this is hitting us all.
And I go back to Mary, I want to definitely give you a chance to chime in, but mentioned at the beginning about layers, you know what I mean? And for many of us, that initial layer is the pandemic that we're all that's the common ground that we're all going through. But as Janice and Ebony mentioned, the systemic racism may have been the primary layer there, and then the pandemic. And so everybody's got these layers that they're dealing with based on what what is personal to you, what matters to you, what you care about, and your values. So I thank you both for bringing that point in, for sure. Mary, did you want to add anything to that?
Yeah, I wanted to, as you guys were talking, I was thinking about the way in which when we are exposed to any form of illness, any break, anything broken, I don't know the adage, but it goes similar to, that's where the light can come in, right? Where something is broken, that's where we have an opportunity for light to permeate. And I think about COVID, and I think about what it has exposed and confirmed for us to such an intense degree about the degree in which racism and sexism have impacted us based on the history of its time in this country. When I think about also the kind of juxtaposition of like a year where we have Kamala Harris, where we have Stacey Abrams, where we have the moms who started all of these great social movements around the harms that have been happening to Black men and women and boys and girls and people of color. that women have really been on the forefront of change in terms of all of these ills that are exposed to a stronger degree by COVID. But in particular, too, with women, it really still hits me every time I see that now iconic image of all of the vice presidents and then Kamala Harris, and then it shows with these little colored boxes what was happening culturally. And the fact that I think it's like the closest box to current time, women couldn't even have a bank account. So in terms of COVID and what it's done in terms of economics and jobs and meals and food, very, very just basic economic. If you can meet your economic needs in this crisis, you're probably, ahead of the curve in terms of being able to manage your mental health and your stress and your anxiety. If you have the ability to work from home, if you have these things, then you've got so many more resiliency factors already in your pocket, ready to go. And for women, much of our work has been unpaid labor. And for African Americans, much of their work throughout history has been unpaid labor. And we don't have systems in place that have made reparations for that. And so I think that that's like another really significant issue, because for the things that have gone into place to help people be resilient in this crisis, they don't have access to a lot of those economic stabilizing factors, relationships with banks, the ability to apply for a small loan, and all of those other things. And so I think in relation to race and gender, I think those two things really kind of resonate with me in terms of impact.
Thank you. Thank you. I know some of you work with kids, or you have worked with kids in the past. When we talk about resiliency, certainly humans are resilient, but kids, they're so more resilient than we can ever imagine with some of the things that we've seen. How do you think that kids are being impacted, and what do you think, if any, would be the long-lasting effects for kids?
I think that there's a lot that, again, everyone has said this evening. I think there's a lot that we don't know. I don't think we know really what all of the ramifications are going to be for all the developmental levels. And we're, as I sat in meetings in the spring with colleagues that serve different age groups, and as I sat in meetings with colleagues from around the world, there are a lot of concerns being shared globally about what's happening for teenagers and kids in college being isolated, and what's happening overall with their mental health. And there were also just as many concerns about what's it going to look like when kids return to school, and how will they do that. And I know that I was part of a number of conversations, and I shared this concern at the time. Okay, kindergartners are coming into school, and they're not going to have the same experience that they had before. They're not going to be able to play with each other in the same way. We're going to have to manage that differently. And we have had to manage that differently. And I think it's been great for the kids to be able to come back to school. But we don't know yet. Kids are having the opportunity, if they have a sibling, to play at home, but they're not having those quite the same opportunities at school that they had in the past. But they're still having the opportunity to be there if the children are attending in person in that particular district. In some places in the world, that's not happening. The kids are not. The kids aren't back in school. But again, speaking to the children's resiliency, a lot of the conversations around the kindergartners, besides play, was around wearing the masks, and would the kids be able to do it? And guess what? The kids wore the masks because that was part of their first experience. So they came in wearing the masks, and it really wasn't It didn't take very long at all for them to adjust to that experience. Now, for children that hadn't done that before, it was harder for them. I know it's a small thing, but it's like kids are making a lot of small adjustments to small things. But now that they've been at school for a while, we're hearing more about some of the stresses in their families and what things are happening. And so I don't think we can know all of the outcomes. We can just try and see as we go and mitigate that if we can.
I think too, it's that, and I like that she mentioned about masks, is that, the kids wear masks, especially if other people are modeling that, right? They're modeling mask wearing, and so they wear them. And I think that's why it's so important that we as adults are offered opportunities to work on and to learn how to take care of our own mental health, so that our students have the opportunity to have those discussions, as well as be able to address their own mental health and feel like they are supported and that they do have outlets for stress, and that they can really be in a space where it's okay to talk about them. Because I think that if they're in a home life where people aren't addressing mental health, their stress level may go up. But if people are talking about it, I have a high school student at home, and he's been, hybridly virtual and at school. And he had a hard day recently where he was really anxious, more than I'd seen him in a long time. But because we've talked about it a lot, he was able to come to me, which my other teenagers, when they were that age, probably didn't do, because we didn't have as much discussion about mental health in the home before the pandemic. So I think it really just resonates that the way that we can help foster that resilience in students, in our youth, whatever age they are, from the youngest to our teenagers and college students, is to really model taking care of our own mental health and offering them opportunities to do the same.
So many of us, either professionally or at home, have been on survival mode that I don't know that we have had the opportunity or been conscious of the importance of modeling that mental healthiness. I was shocked by some of my students who were saying, I can't take this anymore. I'm scared. Kids still have the need to front, to be, cool and be okay with it. So there's a lot of work to be done to normalize, if you will, just how terrifying this is, and it's okay for them to be afraid. They've been creative in a lot of different ways. Sometimes, sneaking to do the things that they want to do, which is connect with each other, interact and socialize. So I think we should really keep our eyes open and be careful in what we might call resiliency, when it might just be denial, like a young person's inability to acknowledge just how terrifying this thing has been. So, and I think too, we really want to encourage creativity in that when they find an outlet, like, let's not just shut it down, let's hear it out. Let's see, because they know something we don't know. They know many things we don't know. We have certain things to offer, but I think as adults, we really want to be in the habit of listening to them and thinking through the things that they suggest to us in a lot of different ways.
Yeah. And I would like to add, in regards to the creativity, this is an opportunity for us as adults to really help channel our children in regards to how they utilize their time. It's kind of difficult because, we're saying, hey, social distance, but, there are different groups in different cities. I happened to be on a Zoom call the other day, and Rochester has this fun city initiative where they basically did their downtown, and they kind of made it like, if you ever been to Disney, the Disney Walk, where they painted the sidewalks, they made all kinds of play and fun things for children, keeping in mind the social distancing. And it's really it's just taken off, because what we find is a lot of our kids are just in the house. Because when we say social distance, some people are thinking, oh, I got to stay home. We got to stay away from people. But we have to be creative. We have to think outside of the box. Take our children out, take them for walks. If there's even when it's not too brisk outside, let them play in the snow. Because the kids are feeling it. I had a 8-year-old tell me the other day, that if he could just take COVID and put it in a box and throw it over the ocean, he would do that. He said, I'm just so tired of COVID. I want to put it in a box and just throw it away. And I was like, yeah, we all do. We all feel like that. Then I talked to a 14-year-old who indicated that, her life is just so different, with school and whatever, and that, she doesn't know how she's going to ever catch up. So kids are feeling it. And they are resilient, but they're going to need so much guidance, so much direction, and so much support and flexibility when this is all over, because when they do return to schools, there's going to be challenges. And we're going to need more social workers, unfortunately, in our schools. And hopefully that'll help them get through this transition of getting back to some type of normalcy. Because right now, this abnormal normalcy is just, we're not so sure where it's going to take us. But we do know that we're going to need a lot of supports, a lot of thinking outside of the box, and a lot of tolerance. Thank you.
I have to kind of giggle when you talk about all the creative things to do with kids, because I was working from home for about 3 months with the Y, and I have a 4-year-old son at home with him by myself. And when we first got sent home, I did the schedule with activities. This is what we're going to do every day. And then by the end of the 3 months, it was like the Wild West. There was tears and screaming, and it was every man for themselves by the end of the 3 months just to get through the day. So I know parents and teachers have had to get so creative with trying to just juggle everything and keep the kids engaged. And like you said, channeling them into positive, in positive ways is so important, but it's so hard some days, but very important. I want to go to our next question. So what would you recommend for people kind of switching now, as we've kind of talked about the impact of different, populations and what it's, what everybody's kind of feeling, to kind of switch gears? Can you tell me your suggestions for people to kind of get to that light at the end of the tunnel? What have you found in your lines of work or that you could recommend to people?
One of the things, and I think it kind of segues a little bit from what you were talking about with kids and people being more at home. I really, for me, one of the most important things to recommend to folks is to do your best to stay on some type of rhythm that is a sleep-wake pattern that you can normalize to what a day might have been like prior. Both for kids and for adults, I've talked to a lot of folks who, by virtue of either working from home or doing school virtually, they're staying up way later, and then they're able to sleep a little later, which is great. If I had my ability, I would be up till 1 a.m. and I'd wake up at around 11 or 12, and that would be my ideal cycle. So I don't expect people to be rigid about it, but to try and kind of get themselves into some sort of pattern so that this way they have that structure. And then with a lot of what people have already said, get outside, walk, move your body, use your voice, whether it's to call somebody on the phone or to talk to somebody over a Google chat. Exercise your voice as much as you exercise your body. And my favorite tip of all, because it is so inexpensive, it has no side effects that are bad, pay attention to your breathing. Every now and then, just pull your attention to your breathing, and you'd be surprised what a nice couple of breaths can do to help kind of just adjust stress that's being held in the body.
I would like to encourage folks it's okay to be spiritual. It's okay, whatever beliefs your family has, to seek it out. Maybe have your kids learn a little bit more about it. Maybe explore if it's a Bible that you use, and seek that part, because sometimes hope comes from not within but outside ourselves, God or higher being. It's a wonderful path to take with your kids, with your family. That it can be really stimulating conversations, and I pair it with the great outdoors. It's looking beyond, looking, to something just bigger than this little world that we have to live in. And the space has gotten even smaller since COVID. So it's a way, to make that space bigger. One of the things that, like Mary said, that doesn't cost anything also is laughter. The arts. We have just making jokes, just seeing your child's creative side, and maybe writing a poem, or if you have more than one, having them come up with a play or something. But just exploring things that time may not have allowed you to do before. It strengthens you, and it just brings the family closer together. So explore your spirituality, own it, share it, and laugh, because this too shall pass.
And I agree so much. And I think now I had offered to share a couple of slides, and they go along with a lot of what everybody has said. So I'm going to share this really fast so I can get to where I'm going. That's not what I was going for. And I think it's really about tending to our mental garden, which is what everybody's talking about. And there are a lot of ways to support our mental health in this time of change. And, it's reaching out to the people in your life who may be able to support you and offering that support. And that may be your faith community, just as she had mentioned. And just acknowledging that it's okay to feel overwhelmed, but it's about focusing on what you can control, even your breathing, which was absolutely what Mary was talking about, and to practice self-care. And there's a whole list of them that I'm going to get to that really represent everything everybody was mentioning, because things may be different, but we can weather these new challenges together, and that we're not alone, and support. And I know we're going to get some resources at the end, are always available. And so there are a lot of self-care strategies to help us, and they go into these 4 categories of mind and body and soul and surroundings. And so first we talk about, mindfulness and developing a new project or skill. I love the concept of writing poems or a play, and really making a gratitude list of things we are thankful for, even in, especially if it's a day where we feel like we got nothing done. If we can make everything from a list of, I got my bed made. I have tried during the pandemic to make my bed every single day, because if I get that done, at least I've done one thing that I have completed during the day. And it is about getting outside and doing exercise, making sure we're getting enough sleep. Yoga and meditation, focusing on our breath, is a huge piece of it. And often we talk about self-care for our body. People think it's manicures and pedicures. It's really about just the mundane, making sure that we're drinking enough water and eating really healthy food. And we've, and sometimes splurging on the thing we really like to eat as well. And when we talk about faith, our soul health, whatever practice you have, whatever helps you, feel connected to others or a higher power, is super important. And that can be helping somebody else, because helping others make us feel better. And lastly, about just making sure our surroundings, if possible, are comfortable spaces for us, whether they're visually or auditorially with music, is that we are spending a lot of time at home. And so it's really about making sure that our surroundings are comfortable for us and bring us support and help support that resiliency that we're looking for. So I think it's really about doing all of those things together so that we can have the ability to support ourselves and all of the things that we need in this time.
I thought those slides really captured a lot of material and also captured a lot of what the people on the panel were articulating. So I think those slides, Sandra, were very, very useful. One of the items that I didn't see on the slides that I've been doing a lot of work around, both informally and formally, has had to do with acts of kindness and the research around kindness. And formally developed a pilot program where I've been teaching teens the research around kindness practices and how that helps your own well-being. And by doing kindness, selecting kind things that you'd like to do for family or friends, that it impacts your own well-being, but it also impacts the well-being of other people. And the teens have been really receptive, and I've been very fortunate that I've had a group of teens that have now been teaching that to elementary students. And then a couple of weeks ago, I had a wonderful experience where the elementary students that had been taught by the teenagers then joined me in a classroom, a virtual classroom, a first grade classroom, and they taught the first graders how they had benefited from some of the kind acts that they had carried out. And they were, as we talked about in the very beginning of the panel, simple things like, I have a younger brother and I helped out with him one day. And when I was helping out, he looked up and smiled at me. And you know what? I also know that my parents were grateful for me helping out in that moment. And being able to, we talked about modeling, being able to have fifth graders model for little first graders, and then they moderated the discussion. I really sat back. I was so proud, like watching them do this thing. And so they're learning things that, they're able to say, this resonates for me, and it builds connection. And then talking to colleagues about what could I do? People trying to find their way and seeing, very much sensing there's a need. And is there a way I could mobilize some people, some kids? Or, I have a mom who's elderly and I can tell she's isolated. Could I get active? So I think having discussions around how can we really choose small things that we can do for each other that connect us, and help teach kids that this is something that they can do easily, that will help them and help their well-being just by being active in that regard.
In talking to some of you before the panel discussion, Anita and I had a conversation where she talked about capital psychology. And I wanted to kind of get your thoughts on that, Anita, and have you expand on that a little bit more for the audience and how that relates to this conversation.
Well, it's really what everybody's been talking about, and what Sandra's slides illustrated. So I think Carrie has a slide for me that's a well-being slide. And really, this was done by Sonia Lubomirsky, and she's a researcher that she did research around your happiness set point. And we all have like a genetic set point that's hereditary. And then the 10% is our outside circumstances. Well, I don't know about you, but this whole COVID challenge doesn't feel like 10% to me. And this was done before COVID happened. But at any rate, she's saying the 10% is your overall situation. And then 40% are your thoughts and actions. And that's really what people have been talking about. So whether it's a gratitude practice or a kindness practice or self-compassion practice, you can make deposits. You can make deposits into your account. Just like if you imagine having a little coin bank and you say, oh, I'm going to do this for myself today, or I'm going to take a mindful walk today, you make a little deposit. When we go through a rough experience, or when we have a lot of stressors, or when we're dealing with a lot of challenges, each time we face that, a withdrawal is made. And what they've discovered through this research is that deposits get made in single digits and withdrawals get made in double digits. So no wonder sometimes we're feeling like, okay, I did a little self-care and I took a little walk today, but I'm still not kind of feeling like, where I need to be. I'm still feeling a little depleted. And so they're saying that by having knowledge around what some of these practices can do, we can empower ourselves by making some deposits. And that's part of why I really like doing the work with kids, because kids can also make deposits for each other. And instead of doing something that's where somebody goes home and complains to a parent about how somebody treated them, isn't it lovely if they go home and they're talking about how someone was very kind to them and looked out for them today?
It's great, Anita. Thank you. We have about almost 10 minutes left, so I want to make sure that we get folks that are watching any resources that you might be keyed into or that you've found kind of throughout the last year or so, or maybe some that have always been there and that they're extra extra useful now for what everybody's going through. Would anybody want to start and just kind of share kind of final thoughts and resources for people watching?
Well, I'll start. First, I wanted to just say that as women, and I'm not saying that only women are watching us, hopefully more than women are watching us, but we have to focus on taking care of ourselves because, we become and we are and we have been the backbones of this society, of our families, of our communities. So what I've realized and what I've tried to do is every week just do one thing that I want to do for me. Just, we find it very easy to do a lot of things for a lot of people as women. So if we could just do one thing for ourselves, because as we build ourselves up, we can then continue the work that we do in our families, in our communities, and on our jobs. During this isolation, quarantine time, we find that we have more time. What do we do with that time? We utilize it a lot with, just doing stuff. So identify something that's going to make you feel, and something that you've always wanted to do. Just identify it and just say, you know what? Every week I'm going to do one thing. I would like to share that there is a lot of resources, people. If, we know that food hopefully is not an issue for a lot of people, but if it is, there are food giveaways all the time. On February 1st here in Schenectady, the Catholic Charities in the food bank is doing another one at the Crosstown Plaza. They have a list out. I think you can go to catholiccharities.com and find out where they are giving out food. We also know that the Department of Social Services is very much up and running, and there's many resources there. So if people feel that, they need help with shelter or help with just getting by, there's definitely a lot of resources out there. Feel free and please, utilize the community because there's services out here. And people are willing to help. I was on a panel once and I gave people my phone number. If you can't get to a food bank and you need somebody to pick food up for you, call some of us. The NAACP, we have a group of people that are willing to pick up food for people and deliver it. So I just wanted to let you know that we're a resource. Thank you.
I want to encourage folks to reach out to, if you have kids in school, reach out to the school. It really, truly is part of the community. I personally, I'm a community person, work with different groups. Bridging the Gap is one, similar to what Janice is saying. There are people there, and we have young people involved in creating the programs and opportunities. It's difficult to say exactly where to turn to find where we are, but sometimes your social worker, your school counselor, the people at school can tell you where those places are. I know in the past, and currently, there's sometimes a lot of negativity between the schools and the community, but we have your children for long hours and we care. We sometimes see things that you may not see. You have a wealth of information that we don't have. But one of the things, I mean, COVID has been a great equalizer in some sense. A colleague was saying she was on a Zoom meeting with some kids and they weren't asking her questions on how to do things. They were asking each other. Because when you look at Zoom, we're all in the same little square box. So it's humbling also to realize we don't have all the answers. So the more you take that chance to seek out support and seek out answers, you will be answering questions for others and providing answers for unanswered questions. So don't go back in your box. Come out, volunteer. You know, look up, look out, look inside. Don't let COVID send you back inside. If you've tried something new and you like it, keep doing it. But look around and talk more. Just let's communicate more.
I'm part of a group that did some work when COVID was first unfolding in the spring, and their mission was to try and support parents in being able to provide support to their kids. And we did write an ebook on going back to school well, but it's still a relevant ebook and it's free. So that's posted right there. But when you go to Resilience Now for Parents, the website, we also created a tip every week. So it doesn't take very much time to read. And so if you're looking for a tip on dealing with strong emotions, perhaps like either yours or your teen or your little one, there are some guidelines there and they're based on pos psych research. And so I think that's something that you can look up and perhaps it may resonate for you.
Sandra or Mary, any final thoughts?
One of the places that I would recommend for those who live, I guess every town has a public library. And I think that there was a time when I think libraries worried and people worried because of technology. You know, will people be going to libraries? Will people be taking out books? And they still are, which is great. But libraries also have, you know, DVDs and movies to rent and potentially maybe even soon audio books that folks will be able to borrow. So I would say if you don't have one, get a library card. And if you do have one, you know, libraries are working a little differently now because of COVID, but they're still looking. So, and they're also a great source for community information as well. So my tip would be check out your library if you haven't already.
Sandra, any final thoughts from you?
Sorry, I was looking for an article link that I could find I wanted that I'll try to add later. I think it's really about connecting to the community and reaching out if you need. We had a question recently about, you know, it is not for people who realize they do need mental health support. Sometimes it's been really hard to find somebody who's taking clients. But there are agencies that do that. Jewish Family Service does, Northern Rivers does. There are some drop-in sites, but also reach out to your school. And if you are employed and have an EAP program, make sure you check out there too, even if it's your child who needs some support, so that you can try to get the help that you may need, is that you don't have to shoulder it all alone, that there are supports out there for you.
Great, and I'm going to have our main number as well as our domestic violence hotline number put in the chat boxes for viewers if they need. As you can hear from our panelists, Schenectady is very rich in social services. We have a lot of people in this community that care about each other and everyone that lives here. And certainly we can't do it all at the YW, but if you call us, we'll certainly try to connect you to the other amazing agencies that are in this community. As we kind of wrap up, reflecting on gratitude and connection, some of the words that we talked about with making it through this. I just can't thank the women enough on this call for offering their wisdom, their support, and you all just make it really easy to have a conversation about how to get through this together. And I'm so glad to meet some of you for the first time. Others, it's great to see a face to the name after so long communicating via email through the pandemic. But really just thank you all so much for your time. And I hope everybody enjoyed our conversation tonight. And if you see these names in the community, we're here to help. So thank you for watching, everybody. Have a wonderful night.
Thank you. Good night.
Nice to meet you all.
Great joining this group.
Meet you too.
Thank you